Hello, in this video I'm going to show you some soft tissue techniques that you can use for the triceps surae, which is the gastrocnemius, the two heads, and also the soleus. We can also modify the technique to include the peroneal tendons, and we've got the peroneal longus, brevis comes down to the tertius. Okay, so we can just adapt the technique a little bit. So what we're going to do, we're going to get the patient to move actively, or I'm going to control the patient passively. We're going to use some variations of like muscle energy techniques, and then we can do something called a PIR and RI of MET. I've already placed some wax on him, and then I'm just using a fascial wax by Songbird, and it works really well. Okay, because we don't want the tissue to be shiny, we just want like a sheen, yeah, rather than it being too much oil on that tissue. Now, the patient is going to lift the foot up. There's no point saying to the patient dorsiflex and plantarflex. Just say lift your foot up and down, like so. That is what they are going to be doing. So we're going to start with the musculature in a shortened position, and then the patient is going to activate the antagonist, i.e. the dorsiflexors, which is the tibialis anterior and the long extensors. And then as he lifts his foot up, even though it might look down, but it's going dorsiflexion, the tissue here is naturally going to lengthen. So let's start in our position here, and I'm going to start with my almost like reinforced fingers. I'm not going to use my thumbs. Try not to use your thumbs, because the carpal metacarpal joint is prone to becoming arthritic if you use it too much. So if you can, fingers straight and then reinforce. So we're going to drop down like this. Okay, start on the Achilles if you want to, and then from there, when you are ready, if you start in this position, okay, and then when you're ready, go in the opposite direction. So we're just going to glide through that, and ease off, and again glide through that, ease off, and again glide through. There's nothing wrong with changing position and angles rather than just following one technique. I can come around here with my fingers, okay, in the central part, off you go, and I'm gliding through, and again and again. Change my angle, okay, so from there and drop right down, almost like a lunging type of motion, okay, so I can just lean forward. So again, when you're ready, off you go, and I can just glide slowly. Like the patient will go as far as they can. They're going to ease off, I will ease off. Off you go. Okay, they'll go so far, come back. You can use breathing in, breathing out as they do that. So from there, if you can relax, take a breath in, and as you breathe out, then they activate the antagonist. And breathe in again, and breathe out, and glide through. You can turn round, excuse me, on my back to you in this one. Take a breath in, and then you can glide down through that. Nice and slow, nice and controlled. Ease off, and off you go again. So you can glide through those tissues and change angles. Quite soon I'll go on to my knuckles, like this, or like this, okay, so it's relaxed, thumb leads the technique. But I'm going to show you something else here. So one way is that the patient actively contracts, is what they're doing like this, okay, so let's just go through that, okay, off you go. So you are gliding up, ease off pressure, apply pressure, and then they repeat the process, okay, and again, from there. So all the movement is done actively by the patient, and you are gliding through the tissues. And again, you can turn around, you can swap hands. But if you look at this one, what I tend to do, the foot is in like a mid-thigh. So what I'm going to do is I'm going to let go, good. So I'm going to use my movement to passively stretch him. So this is done passively. You can use your fingers if you want to. You can glide through that and ease off, and I can control everything. So I can just work through those tissues. If I'm honest, I like to use my knuckles quite soon as I do that movement. Okay, so I'm using my thigh to passively lengthen the tissues here. And this works. I can swap my hands, and I can happily glide through the tissues here. Now, if I ask my patient to push against my leg, pushing down, he's obviously contracting the muscle. Contract, push for 10 seconds. So what we do now, it's a post-isometric relaxation technique of muscle energy. Okay, so he's contracted for 10 seconds, relax, take a breath in, and as he breathes out, don't do anything, let me do it, So I can now glide up. So we have this window of opportunity where I can lengthen and almost like stretch the tissues out. Yeah, coming through from there. Around the Achilles area, again, I can control the movements. I can use 2 fingers or 1 finger reinforced in here, and I can just glide around that posterior part of the lateral malleolus. So I can just slowly come in and glide through. Again, not using my thumbs, just using that reinforced finger, working around the area. The Achilles tendon typically has a tendinopathy, a tendonitis or tendinosis, which is more of a degenerative tendon around here. You can use your thumb and finger like this if you want like a pinch grip, and I can just glide up, or you can use thumbs in lightly, okay, and then you can just glide through and just work it. Don't work it too much because you might irritate. If someone's got a tendinopathy or tendonitis, okay, think of the letters itis, it's inflamed. No doubt by working it and working it and working it, you can make it even more inflamed. Okay, so do something, but don't do too much to irritate that sort of area. You can drop to the forearm area in here. Be careful with pressure. Not everybody likes the pressure within. And then from here, I can drop down when you're ready, Max. Slow, that's it, and then off you go again. So he is literally just lifting his foot up as I glide through. Ease off, I ease off, and I glide through. Ease off, and again. If I want to, I can then come around and work from an area to come down. A little bit on the peroneals, just have a line on his side a little bit, like this, okay? Keep the small towel there. So we've got the peroneals. I've already put some wax on that area here. Now the peroneals again are plantar flexors and everters. So we're going to lengthen them by, you can see the peroneal brevis here, yeah, coming to the 5th metatarsal. And longest behind that around the cuboid, and it comes down to the 1st metatarsal here. So what we can do, you can either get him to invert, okay, or you can get him to dorsiflex. Doesn't really matter. So we'll do a dorsiflexion. I can use fingers, but I'm going to start on my knuckles, if you like. When you're ready, just lift your foot up, and I'm going to glide up. Be careful because it can be a little tender on this one, and he's off. And again, gliding up, and again. If you prefer to use the fingers, reinforce and glide up. As you come up towards the head of the fibula, be careful because you've got the common fibular nerve here, which becomes the superficial and deep fibular nerve, yeah, which comes from the sciatic nerve, which comes from L4, 5, S1 and 2 and a bit of 3, okay? So as I glide up, off you go. So I'm just working through, ease off, and again. Quite sensitive, the peroneals, so I suggest you don't use so much pressure working through. Forearm is okay because of a wide surface area, but drop down, even just leaning on him when you just glide in through the tissues would work okay. Okay, as he lifts up, we'll do that. If you're not sure about the lifting up, get them to roll the foot as if they're going to go over like a sprain. Okay, so it's not the easiest movement. I can control, can you see? I can control that if I want to, so I can do it passively. Passively. Last thing, if you push against my hand, okay, no. Let's do that again. Let's place this back under. So if you get the person to say evert, so you're pushing against my foot that way, so you're contracting for 10 seconds. And as he relaxes, it's like an MET PIR, take a breath, and then you can just roll the foot, not yet, as I'm gliding through the tissues. Okay, so you can mix and match a lot of the techniques there. So we've done the triceps surae, the gastric and the soleus, and we also did a little bit of the peroneals, but just watch that fibular nerve. I hope you've enjoyed the video, and thank you for watching.